Have you ever wondered how hormones can impact your health as you age? For many women, balancing estrogen and progesterone can significantly enhance their quality of life. With proper hormone replacement, women often experience better sleep, improved mood, and stronger bones. However, a common concern arises: does hormone replacement increase cancer risk? Most studies indicate that while some risks exist, natural progesterone can reduce estrogen-induced cellular proliferation, especially in breast tissue. This is a key finding for those considering hormone therapy. Implementing a healthy lifestyle can further reduce breast cancer risk. Consuming cruciferous vegetables, maintaining vitamin D levels, and avoiding well-done meats are crucial. Hormone restoration is an important strategy that should not be overlooked. As women age, they often accept hormonal deficiencies as normal. However, data suggests that restoring hormones to youthful levels can combat the negative effects of aging. Studies reveal that diets rich in vitamin D, soy, and cruciferous vegetables can lower breast cancer risks. For example, vitamin D's protective effects are remarkable, often resulting in a 70% reduction in breast cancer risk for those with optimal vitamin D levels. To lower breast cancer risk, focus on nutrition. Minimize intake of red meat and sweets while increasing consumption of vegetables and fish. Cruciferous vegetables contain indole 3-carbonyl, which promotes healthy estrogen metabolism. Isoflavones from soy also play a role in cancer prevention. Numerous studies have shown that high soy intake is linked with reduced breast cancer risk in women. Furthermore, evidence suggests that dietary lignans and green tea have promising anti-cancer effects. The Norway spruce, Picea abies, produces abundant quantities of the plant lignin 7-hydroxymatersanol, or HMR. In the digestive tract, HMR is converted to an active compound called enterolactone. Both HMR and enterolactone are mild phytoestrogens, and as such, offer additional support for women undergoing menopausal transition. Dong Quai has a long history of medicinal use in Asia for menopausal symptoms. Chasteberry contains compounds in both the berry and the leaf that have been shown to induce relief of common menopausal symptoms. Studies attribute these effects to activation of estrogen receptors, indicating that the plant has beneficial phytoestrogen properties. Estrogen plays a pivotal role in overall well-being. The human diet significantly impacts cancer risk. Women consuming more meat, particularly red meat, have been shown to have elevated breast cancer rates. Conversely, diets high in vegetables are associated with lower cancer risks. Understanding age-related breast cancer risk is vital. Aging is a stronger cancer risk factor than hormone levels. Women are encouraged to make lifestyle and dietary changes that can increase the likelihood of healthy aging. Plant foods not only enrich a balanced diet, but they also support detoxification processes in the body. Compounds like D-glucarate help in removing harmful substances, thereby protecting against cancer. In conclusion, enhancing your health and aging is feasible through hormone balance and dietary choices. Incorporating these dietary strategies can foster better health and reduce cancer risks. Take action today. Health awaits you on the other side of these empowering steps.